Mr.
No.
SH. I'm Dil, the student nurse practitioner. I'm just going to go over why you're here in the office. Mr. SH is present to the office today with complaining of sore throat and not been having having some difficulty swallowing. Basically, he can swallow fluids, but it's just eating. It's been difficult. He's been having a low-grade temperature of 100, for which he took Tylenol, and also he has had some left ear pain and some left neck pain. Mr. SH is have a history of thyroid, hypothyroidism, diabetes, and some insomnia, for which he takes medications. He has prior history, surgical history of gallbladder removed. That's the only hospitalization he had. He's up to date on his childhood vaccinations, and he have received MMR, polio, BCG, and a tetanus booster, and also he's up to date on his flu shot for this season. He's not had any other surgeries other than the gallbladder, for which he had general anesthesia with no complications, no prior blood transfusions, or he have no known allergies, except he's allergic to food, which is the ginseng food. He have hives and rash. For diabetes, he takes glucophage and levothyroxine for thyroid, and melatonin at night for sleep. He works in an office setting, and he does not smoke. He drinks wine or beer occasionally. He lives in a single family home with his toddler and his wife. Basically work in the computer setting, no exposure to any environmental, industrial things, pollutants or anything like that. No smoker. He follows a regular diet, exercise, walks 3 times a week. Just going to go over his symptoms, and based on his symptoms, I'm going to assess the ear, nose, and the throat, and also the lymph nodes, and also his skin, given the sore throat, and also the cardiac and the respiratory. I'm just going to start with assessing his skin. Overall, going to look at the skin color, no wounds, no lesions, basically looking for rashes, no rashes. If there's moles or lesions, we'll assess them at the ABCD method. Then I'm going to touch the skin. It's warm and dry, good capillary refill, no clubbing, no cyanosis, good skin turgor. Basically, I was looking for rashes given his strep throat symptoms. So I'm going to move on to his ears. We're going to basically inspect the ears for any kind of drainage on the outer ear, or any redness on the ear, any deformities in the ear, outer ear. The auricle, both looks okay. And then we're going to look at the, with an otoscope, look at the ear canal. And we're going to look the outer ear canal. There's no drainage or any redness or anything like that. No any signs of swimmer's ear or anything like that. Some cerumen and hair, and basically, yeah. Basically, looking outer ear is outer ear has no drainage or redness, no signs of infection on the outer part, and the inner ear landmarks you're looking for is the light reflux, the ombo, and the hand of Malus. The tympanic membrane is translucent and pearly gray. There's no bulging, any signs of fluid, any kind of middle ear infection, no bulging tympanic membrane or anything. So both ears looks good. There's no drainage or redness. On the tympanic membrane looks pearly gray. And I'm going to move on to the nose. Look at the nose, inspect the nose. this no deformities or anything in the nose. I'm going to look inside the nose, nasal mucosa, pink, no drainage, no nasal drainage or anything like that. I'm going to do the patency, nose one minute, do the other, and then no drainage or any kind of clear nose, clear both nostrils. Going to also look at the lips. Lips are good color, no cyanosis or anything like that, no lesions, no soles or anything like that. I'm going to look at the mucosa, this pink, and there's some missing teeth, but the uvula in midline and the pharynx looks red. I'm going to look at assess the vagus nerve 10 by saying and also the bilateral tonsils are enlarged 2 plus, 1 to 2 plus, and there's some exudate in it, so definitely there's some throat redness, pharynx redness going on, and I'm going to ask him to set the strength of the tongue. I would not assess the grad reflex at this time. I'm going to assess the cervical nose given his pain in the left side. I'm going to start assessing all the lymph nodes. I'm going to start with the preauricular, postauricular, occipital, posterior cervical, parotid, tonsillar nodes, submandibular, submental, and I'm going to assess the superficial cervical, deep cervical. And this is the supraclavicular nodes also. I would not assess the axillary nodes at this time. And I'm going to move on. I want to assess the temporomandibular joint because of his given ear pain. So, should be having any pain?
No.
There should be just some clicking noise, no pain. And I'm going to move on to, he has some neck pain. I can assess his nuchal rigidity, see if they have any stiff neck or anything like that. Bend your neck, see if you have any pain. We can do range of motion on the neck and see if you have any pain. Or we can do Koenig or the Brudinsky sign to assess if he has any stiff neck, but he does not have any pain. You can do a flexion, upper extension, rotation, external and internal rotation. Okay. We're going to move on to assessing the respiratory system. I'm just going to inspect him, like see whether he have any acute distress, no dyspnea, no use of accessory muscles, symmetric chest expansion. No, just going to do the chest, symmetrical chest expansion. Take a deep breath. And check for the symmetrical chest expansion. And I'm going to percuss his lungs. No. And the sound should hear the resonance. I'm going to listen to his lungs. I'm going to listen to his lungs and posterior side, 6 sides. Deep breath. Inspiratory and expiratory. Deep breath. Basically 6 sides, and I'm going to listen the anterior chest 4 side, and you can just relax your arm. That's good. Thank you. Deep breath. And the lateral side, 5 sides. Deep breath. Bilateral, bilateral, the red sounds clear on auscultation. Bilaterally, clear on auscultation. Can't hear any V's and rails or any ronchi or nothing like that. Or clear on auscultation, all bilateral breath sounds. And I'm going to assess his CVA tenderness. I can do the direct or indirect. I'm going to do the indirect approach. Any pain?
No. No.
Alright. Just going to assess the cardiac system. I'm going to see any heaves or pulsations, assess, and then I'm going to use the palm of my hand to feel for any bruit, feel for any thrills, for thrills. And the maximal pulse PMI can be assessed on the mid-clavicular 5th intercostal space. I'm going to assess his heart sound starting with the aortic, which is the right sternal border, 2nd intercostal space. And the left sternal border, 2nd intercostal space. Left sternal border, 3rd intercostal space, the big point. And left sternal border, 4th intercostal space. And the mid-clavicular, 5th intercostal space is the maximal pulse index, PMI. And if I'm assessing for any murmurs, I'm going to listen with the bell to all of them again. And the heart rate was regular. And lay down. And I'm going to, if I'm going to assess for murmurs, I'm going to let him turn that side. And the PMI side. For any murmurs. And I'm also going to assess his pulse. His heart rate was regular. I'm going to assess for his radial pulses, basically. Pretty regular. Those are the systems I assess because given his symptoms can be sore throat. His ear was, there was no drainage, or the tympanic membrane was not bulging or anything like that. There was no fluid collection. So his tonsils were very large and red. The pharynx was red, and given his temperature, I would just come up with the diagnosis of acute bacterial pharyngitis, or it can be viral. For that, we have to do a swab and see whether rapid strep swab to see whether it's just a viral sore throat or a bacterial. And thank you very much.
You're welcome.